Hey everyone, I'm Amanda, one of the vestibular therapists at Excel Physical Therapy. So I just wanted to make a short video just to educate people what vestibular therapy is and what kind of an evaluation would look like via vestibular therapy, and kind of the options right now that we have via telehealth that we can do too, that you can do right here on your couch if needed. So what is vestibular therapy? Vestibular therapy is pretty much how your brain recognizes signals coming from your vestibular system, which is in your inner ear, how that passes along information from your vision, your balance, and your proprioception, which is your body awareness in space. So one of the most common referrals that I get is for something called BPPV. Now you may have heard of this term before, but may not have known what it stands for, what it means. So it stands for benign paroxysmal positional vertigo. And what that is pretty much is that in your inner ear, there's a dysfunction of your motion detectors. So there are these really small microscopic crystals called otoconia. And what happens, usually related to age or head trauma or concussion, that these crystals can become dislodged into different canals. So there's 3 canals that it could go into. Sometimes it goes into multiples. So my job as a vestibular therapist is to figure out which ear that happened in. Sometimes, unfortunately, it can happen to both ears, and then which canal it went into. So today what I'm going to show you is an examination, a treatment, and then a follow-up exercise. But big disclaimer here, please do not try this at home. Make sure that you consult a physical therapist and be evaluated first. This is just to kind of give you an idea of what you can do via telehealth if you need to at home. I do highly recommend, if it is safe for you to come to the clinic, I would come in just for initial evaluation, then we can always do follow-ups via telehealth. But again, if you need to do this from your home and you're suffering from dizziness and vertigo right now, this is a kind of an option that we can do for you. So the first thing we're going to do, we need to test to figure out what ear is involved. So I'm going to show you one for the posterior canal. Again, there's 3 canals that could be in. I'm just going to demo here the posterior canal. So we're going to do a test that's a modified Dix Hall plate that you could do right here on the couch. Again, I like to do this a lot with my older patients that may have some spinal issues. So what we're going to do is we're going to test your left ear first to see if that's the problem ear. So we're going to rotate your head to the right to about 45 degrees, and then we're going to quickly lay down towards your left side. Okay, so ready? We're going to go 1, 2, 3. Now keep your head pointed up towards the ceiling. And I would stay here for about a minute to see if any symptoms come on. All right, so we'll say you didn't have any symptoms with that. You'll come up, just rest a minute, make sure that you feel okay. And we're going to test this side. Now, for purposes here, we're going to say that this side is going to be positive, and then I'm going to go right into a maneuver. It's called the Samant maneuver. Again, it's another modified sideline position that you can easily do on a couch, okay? So we're going to go into the testing position first, and then we're going to go right into treatment. So we're going to be testing, again, the right ear. So we're going to be turning your head to the left, okay? Ready? 1, 2, 3. So again, if this was positive, you would be feeling vertigo or your normal symptoms here. So you would wait about a minute or until symptoms resolved plus a minute. So say that happened, and then we're going to come up and over to the other side. So keep your head tucked in and at about 45 degrees. Here we go. Now you're going to keep your head down on the couch. I'm just looking up so I can talk to you for 3 to 5 seconds, and then you're going to do 4 to 5 head shakes here. Okay, and then you're going to stay in that position for about a minute or until symptoms resolved plus a minute. And then you're going to sit up, and when you sit up, make sure that you keep your head tucked down. And you're going to hold that for about 10 to 15 seconds, and then you can sit up. So sometimes we'll repeat that 2 to 3 times just to make sure that we have relocated all the crystals back into their proper position. And then we would do follow-ups with that. Now the last thing for an exercise, during examination we would have tested this, something called your vestibular ocular reflex, your VOR. And with this, a lot of times it's kind of your interpretation of how your vision and your gaze stabilization, so that you know that your eyes are staying straight as your head or your body is moving. So we'll do something called VOR times 1. All right, so for VOR times 1, you're gonna have a sticky note that just has like a big letter A or a big dot on it. You would normally stick this on a wall, but just so you can see what I'm doing, I'm just gonna hold it out in front of me. And we have a metronome app that we use for free, so you can adjust the beats per minute on it so that you can keep your head moving. So typically we wanna work up to doing 120 beats per minute. Again, that's going to be determined on how you are with your baseline. So I'm going to do 120 beats per minute. We're going to do VOR times 1 in both the vertical and horizontal plane. So I'm going to do vertical first. So your eyes are staying stationary as your head moves. Okay, and then we'll do vertical. So horizontal. Okay, so again, you would just be having your eyes stay focused on the object as you're going back and forth and up and down. Typically we would do this in standing, but sitting is also an option for that. And so that kind of is what a mini little vestibular therapy session looks like, and the option that you can do it from home via telehealth. So if you are unfortunately experiencing dizziness and vertigo during this time, please feel free to give us a call and we can get you set up with an initial evaluation. Like I said, there are options to do it via telehealth if you're not able to come into the clinic right now. Thanks so much. Hope you guys have a good day.